Welcome to Chamber Exchange, a TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, a TV show, is an opportunity for us to bring on our chamber members as guests to talk about their particular company and the work that they're doing, to talk about issues of economic development and public policy that affect the business community here in the region as well. And the show is brought to you by our sponsors, Bank Hometown and St. Vincent Hospital. So very pleased to have with us on our first segment, Nana Antwi Boasiako, who is the president and CEO of Omama Home Healthcare. Nana, welcome.
Thank you.
Well, in central Massachusetts, healthcare is our biggest employer.
Mm-hmm.
Obviously, UMass Memorial Healthcare System, St. Vincent Hospital, UMass Chan Medical School, some of the other healthcare facilities. But it also, in that definition, includes companies like yourself that provides personal home care options for individuals and families.
Yes, thank you. Yeah, so like Tim said, I'm Nana, and I'm the president and CEO of Omama Services Incorporated. Omama Services, we do varieties of health services, which includes skilled nursing and non-skilled, which normally people call VNA services for the skilled. And we also do transportation, non-medical transportation services, and also home health aid certification training. The services that we provide is basically helping clients or patients in their homes. Like the VNA services, when, for example, St. Vincent discharges a patient to their home,
right,
and they require them to have PT, OT, nursing, home health aid. They send the referrals, and then we will have the clinicians go in to provide the services for the person, and also do reassessment, if the patient needs continuous of care, and then we communicate with the doctors for them to send in doctors' orders. Then we communicate with the insurance companies also to give us like the authorizations to proceed with the care.
And this is, can be for an individual or a family that's dealing with this. This
Exactly.
can sometimes be overwhelming, and having what's included, what's paid for, what isn't. And so you can kind of help them not only provide the care that's needed, but help them navigate
the payment options and other stuff. Yeah. So when it comes to home health or home care, I know it confuses a lot of people. Home care is non-medical. Home care services is non-medical. Home health care services consists of the medical part. But when you are home health care, you go through a lot of accreditations like Medicare, Mass Health, CHAP, and you get all those accreditations. Then you deal with the insurance companies also for contracting. So there are so many payment options, like if you have the insurance, you can also pay from your pocket. So it's basically two payment options. When it comes to home care, they have something called private paid. The state also provides basic home care support through elder services, Massachusetts Rehabilitation Commission. So,
and those are for set periods of time.
Yeah, set periods of time.
So sometimes you can use that, then stack.
Yes,
right.
But these basic services are like personal care, doctor's appointment escort, homemaking. But it's for a certain period of time. And I think in Massachusetts, almost every insurance company does that. Toft does it, Navicare, Fallon, they all work with other services. And sometimes when you have the direct contract with them, you can also work directly with them. So
that's something, if someone gets a referral, you can kind of help educate them, review what they have maybe paid for or eligible for, and kind of put together that plan, both on the healthcare side, but also you mentioned that important differentiation between kind of healthcare and then home care.
Yes. So, and one beautiful thing about the payments are, and I think most families don't know, is some of the insurance companies, not Medicare, but some of the insurance companies, when you have their insurance, sometimes they have coverages that cover for home care services. That is 35 hours per week. So, for example, let's say you, Tim, you are not feeling well, even though you still have the energy to work, and you go to the hospital, they refer you back home, and you need home care assistance, somebody to help housekeeping, taking care of you, and you have insurance. It doesn't matter that, oh, Tim, everybody is expecting Tim will pay out of pocket. No, if you need just 35 hours, based on the insurance that you have, we can work with the doctor and the insurance, and then the insurance company will pay for the 35 hours for the home care services. But a lot of people don't know it, so they don't take advantage of that. And we have families to also navigate that. Yes.
And then, once you've kind of fully understand or maybe fully utilized the various things, whether it be through insurance or some of the governmental programs, then there is the ability also to do private pay with you as well.
Exactly. So we have the private pay option that mostly families that don't qualify for certain basic home care incentives, or they want long hours, 24-hour care, they have to pay out of their pocket. So we have that option. We have that option for families also to pay out from their pocket, and we provide those services also for the families.
And I know of a situation where your company provided some services and to an individual and their family, but you went in and you did the assessment.
Yes, exactly.
You sat with the family, figure out what are the hours of coverage, where are the gaps.
Exactly. So I think one thing that I've realized in the home care or home health services is when the companies or the agencies send somebody to your house, they don't really give you like a reliable caregivers, right? So if you have 12-hour shift Monday through Friday, today there is caregiver A, tomorrow there's caregiver B. So you don't have like consistent caregivers. But with us, I'm a caregiver myself. I've been a caregiver myself. I have a lot of references being a caregiver myself. So I want to make sure that our clients are being taken care of. We keep like the consistency of the caregivers. That builds trust. Because especially with the Alzheimer's, dementia patients, if you keep changing people every blessed day, they get confused. And things will be getting worse. But if they know that this is the particular caregiver that I have, the moment they get the connections, they get used to, it's easy for care to be performed.
Those routines,
yes,
the consistency,
exactly.
familiarity with the patient,
exactly.
Right. So there's a whole host of services that you provide that you can assist individuals and families with. And how, the area that you cover, and we've just got a minute or two left. I also want to let people know how they can go on the website, contact you, maybe have a conversation.
All right. So we have a website. It's Omama Home Health Care, omamahomehealth.net. And then the office number is 508-459-1549. So when they contact us, we will let them know the variety of services, because we provide everything about home health care and home care. We provide it at Omama, and as well as transportation services. We also,
that's important too, the transportation services.
And we also provide live-in services. And if I have a chance another time, I will explain to families how they can utilize live-in services for them to save a lot of money when it comes to home care services for their loved ones.
Okay. Yeah. And it's omamahomehealth.net.
Yes.
And that's where the range of services. Yes. And just in the minute we have left, the other piece is oftentimes the hospitals are pushing to refer people out and getting services at home. But physical therapy, occupational therapy, other things that you can help provide those providers and deliver those services as well.
Yes, and yes, because We are Medicare accredited, we are CHAP accredited, Mass Health. We do Mass Health CSN program, the continuous skills services and home health as well. So we can work with the hospitals. We also do medical staffing. If they are in need of support with like staffing needs in their ER for one-on-one care, we do all of it. We go to assisted livings, nursing home to help with staffing as well.
Augment that. Okay. Well, omamahomehealth.net. Nana, thank you for being with us. Thank you for being such an active member of the Chamber.
Thank you.
And appreciate what you're doing. Look forward to having you back.
Thank you too. Thank you for this great opportunity.
Yeah. And we're going to come right back for our next segment. Stay with us.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.